Swine flu vaccine is headed our way, and state health officials say this will be the biggest shipment yet. But they warn if you are not in the high-risk groups, it will still be several weeks before vaccines get to you. News Channel 36 reporter Michelle Bowden is live with our mobile newsroom at Presbyterian Hospital.
Yeah, here's how it works. Area hospitals and health departments get the vaccinations. Then they go out to OBGYNs and pediatricians. And it sounds like it's a good thing because pediatricians we talked to today said they're getting a lot of calls from concerned parents who want to get their hands on the vaccine.
Is he going to have the hiccup, Daddy?
For 4-year-old Cooper McLemore,
tilt your head up just a tiny little bit.
It's just another annoying thing to deal with at the doctor's office.
Good man.
But the swine flu vaccine he just got, among the last at his pediatrician's office.
We're out probably in the next few minutes.
Dilworth Pediatrics ordered 2,000, got only 200.
Last night was our first clinic, and it was a bit of a zoo.
So this office, like most in the area, will wait with fingers crossed for what the state says should be a big shipment next week, the biggest one so far.
I hope so. Certainly, I hope so.
Because
parents are calling.
There's a lot of concern.
We have been swamped on a daily basis for the last several months.
Then there are other parents
I wasn't very concerned about it,
who aren't that stressed and say they realize most cases of the swine flu are just like a bad cold.
I'm not really worried about the supplies.
Still, the doctor is hoping to get enough vaccine for all her patients.
We're just waiting every day to see what the mailman brings.
So the best advice is to call ahead to see if your doctor has a supply before you go in. One other thing we learned today, very interesting, the CDC in about a week's time is getting ready to launch on their website. It'll have a listing of all the area flu shot clinics. So that'll be interesting. But remember, it's going to be about a week before they launch that. Also, if you're not in one of the high-risk groups, we learned today from the state, it'll probably be the end of November. It'll probably be the end of November, early December before the vaccine will be available to you. Reporting live now from Uptown, Michelle Bowden, News Channel 36.